Thank you, Mr. Chair. Dr. Lynch, thank you for being here today. And Mr. Chair, thank you for calling this hearing to discuss such an important issue. Right now, there are over 100,000 Americans on the transplant waiting list, hoping to receive the phone call saying that they will finally be getting their transplant. While we must address flaws in this system, it is important to also recognize that it saves lives. Just last year, there were over 48,000 transplants in the U.S., the most ever, and that was made possible by over 24,000 unique donors. And yet, we still don't have enough donors. 13 people die every day waiting for an organ in the U.S. To reduce needless deaths, I believe that Congress must work to strengthen the public's trust in the transplant system. Donors need to trust that their selfless gift will be used wisely, not only by the dedicated medical teams performing life-saving transplants, but also by a federal government that prioritizes safety and conducts strong oversight. While I'm confident that many OPOs are highly committed to ensuring rigorous safety protocols, HRSA's investigation highlights some inconsistencies regarding how much authority is given to OPO staff during the organ donation process. In a medical setting, confusion can have heavy consequences. OPTN policy states that when evaluating whether the patient would be eligible for donation after cardiac death, called DCD, quote, the primary healthcare team and the OPO must evaluate potential DCD donors to determine if the patient meets the OPO's criteria for DCD donation, end quote. Dr. Lynch, in your assessment, how is that collaboration, that collaborative evaluation supposed to happen? And is there a lack of clarity about this policy that needs to be addressed by OPTN or HRSA? And if so, what steps are being taken to provide that clarity?
This is a public good. Transplant is a good thing. It is a focus for the federal government. 3 successive administrations have worked to build our ability to deal with this, and we've enjoyed support from Congress in that role. The work that is done here, the collaboration between the OPO and the primary hospital, is one where the OPO is the driver. They are the one with whom the decision to proceed down a procurement pathway begins and ends. The hospital cannot force them to do that. The family cannot force them to do that. The OPO is the subject matter expert, and it is their call on what constitutes a potential organ donor.
So I want to ensure that we aren't only reactively conducting oversight after a horrifying case and examples of those cases. Oversight over the transplant system needs to be forward-thinking and proactive. So, Dr. Lynch, are there any other strategies that HRSA is considering to improve the interaction between OPO staff and hospital staff and their respective roles on these DCD cases?
So there's 2 elements to that. The first is that, as you say, proactive is best here. Developing a true denominator for all these interactions is important. We know that over 1.1 million cases last year, an individual was referred to an OPO. Many of those individuals recovered. A referral was made, and the OPO opted not to proceed with evaluation. But HRSA's ability right now to know what happened at subsequent steps until somebody was an organ donor with what's called a UNOS ID is poor. We're improving that, and I think the best way to understand the utility of that is if you ask somebody, is air travel safe because there was an air disaster yesterday, you would want to know how many flights happened yesterday or last year to know if it's a single event or a common event. That is what we are doing here. In terms of providing the education and making sure that roles are understood and that the goals of care are collaborative, that is something that is an OPO's obligation to perform. They can do that in the abstract, so to speak, making sure that hospital staff are made aware. And then when a potential donor patient is identified, they should have just-in-time training to go through what the steps that will follow are, and to give everybody a clear understanding that if the patient status changes and they would not be considered a candidate, that the process should be halted or can at least be temporarily halted while that's investigated.
I appreciate that. Thank you for your report and your continued work. Clear delineation of the roles of OPOs and hospitals is essential to avoid preventable harm to potential organ donors. Far too many people die each day waiting for an organ. It is critical that patients and their families have confidence in the decision to be an organ donor, a noble decision that can one day save a life. And with that, I yield back.